This video is on epilepsy. So, epilepsy is a condition that affects the brain and is defined by repeated seizures. It affects more than 600,000 people in the UK, and almost 1 in every 100 people has this condition. The main symptoms are repeated seizures, and these are different types of seizures depending on which part of the brain it affects. So, the cells of the brain, known as neurons, conduct electrical signals. They communicate with the brain using chemical messengers. During a seizure, there are abnormal bursts of neurons firing off electrical impulses. This causes the brain and body to behave strangely. The severity of seizures can differ from person to person. Some people experience an odd-like feeling with no loss of awareness and can have a trance-like state for a few seconds or minutes. Others lose consciousness and have convulsions, uncontrollable shaking of the body. Some people might only have a single seizure. If they do not have a high risk of having further seizures, they will not be regarded as having epilepsy. So people with epilepsy can experience any type of seizure, although most people have a consistent pattern of symptoms. Seizures can occur when you're awake or asleep, so it depends on what area of the brain it affects. So these can be focal or partial seizures, where only a small part of the brain is affected. Generalized seizures, where most or all of the brain is affected. And some seizures do not fit into these categories and are known as unclassified seizures. Focal aware seizures are where you remain fully conscious. Symptoms of a focal aware seizure can include a general strange feeling that's hard to describe, a rising feeling in your tummy, which is like a sensation in your stomach when on a fairground ride, and intense feelings that events have happened before, known as deja vu. Experience an unusual smell or taste, a tingling sensation or pins and needles in your arms and legs. A sudden intensive feeling of fear or joy, stiffness or twitching in a part of the body such as arm or leg. These seizures become known as warning or auras because it can be a sign that another type of seizure is on its way. This will give you time to warn people around you and make sure you're in a safe place. So, focal impaired awareness seizures are when you lose your sense of awareness, you won't remember what will happen. So, you can have smacking your lips, rubbing your hands, making random noises, moving your arms around, picking at clothes, fiddling with objects, adopting an unusual posture, chewing, swallowing, or you won't be able to respond to anyone else, so you have no memory of it. So I can see on this slide here, there's 6 main types of seizures, so I'll go through them. So absence seizures mainly affect children, but they also occur in adults. They cause the person to lose awareness of their surroundings, usually up to 15 seconds. The person will seem to stare vacantly into space. Some people flutter their eyes or smack their lips, and the person will have no memory of their seizure. Absences can occur several times a day. They can affect the child's performance at school. They can be dangerous if they occur at a critical time. These type of seizures cause your arms, legs, or upper body to jerk or twitch as if you're receiving an electric shock. They often only last for about a fraction of a second, and you'll normally remain conscious during this time. Myoclonic jets often happen in the first few hours after waking up. They can occur in combination with other types of generalized seizures. These cause the same sort of twitching as myoclonic jets, except the symptoms will last longer, normally up to 2 minutes, and you can lose consciousness during a clonic seizure. For atonic seizures, these cause your muscles to relax suddenly. There's a chance you can fall to the ground and injure yourself. Tonic seizures cause all your muscles to suddenly become stiff. You can lose balance and fall over. Like atonic seizures, there's a risk of injury. So tonic-clonic seizures or convulsions have got 2 stages. Your body will initially become stiff, and then your arms and legs will become twitching. You will lose consciousness, and some people will end up wetting themselves. The seizure normally lasts a minute but can last longer. This type of seizure is what most people think of as epileptic fit. For myoclonic tonic seizure and myoclonic atonic, these are seizures involving a combination of the both. And finally, looking at the status epilepticus, this is a name for any seizure that lasts longer than 5 minutes, or a series of seizures where the person does not regain consciousness in between. This is a medical emergency that requires treatment as soon as possible. So you can be trained to treat status epilepticus if you care for someone with epilepsy, though emergency treatment will be required. And a medication called bucomidzolam, it comes in a liquid form and is given by tickling the liquid into inside a person's cheek or their nose. And you can also have diazepam, which is placed in a person's rectum, but that's less commonly used. So in some cases of epilepsy, a cause cannot be found. If there is an identifiable cause, it usually involves the brain being affected by a condition. The brain is a delicate mix of nerve cells, electrical impulses, and chemicals known as neurotransmitters. Any damage has the potential to disrupt the workings of the brain and cause seizures. So categories can be structural, so that will include cerebrovascular disease, problems with your blood vessels that supply the brain, such as a stroke or cerebral hemorrhage, brain tumours, severe head injuries. It can be genetic, so a genetic abnormality can cause epilepsy. So epilepsy is hereditary, passed on from one or both parents, or it can be a new gene abnormality. Infections like meningitis can cause damage to the brain, which can result in epilepsy. Viral infections like HIV can also cause epilepsy. It can also be caused by an imbalance of the body's chemicals, so autoimmune conditions such as encephalitis, which is inflammation of the brain, can cause someone to develop epilepsy. In many cases, there is no cause of epilepsy found. Seizures can also occur without any obvious trigger, and these include stress, lack of sleep, withdrawal from alcohol, following heavy drinking, medications, illegal drugs, menstrual cycle periods, flashing lights, etc. So for diagnosis, because it's difficult, because it's similar to other conditions where fainting, migraines, and panic attacks occur, it is difficult to diagnose quickly. So you'll usually get asked about your medical and personal history, whether you use any medicines, drugs, or alcohol. You can also get an electroencephalogram, an MRI scan done, and even though the tests don't show anything, your symptoms and descriptions of your seizures can result in a diagnosis. So to go into an MRI scan, this is a type of scan which uses strong magnetic fields to produce detailed images of the inside of your body. So it's useful in cases of suspected epilepsy and can often detect the possible convulsions of the condition, such as defects in the structure of your brain. For your EEG, your electroencephalogram, this detects unusual brain activity associated with epilepsy. It measures the electrical activity of your brain through electrodes placed on your scalp. So during the test, you're asked to breathe deeply or close your eyes, and you can be asked to look at a flashing light. The test will be stopped immediately if it looks like the flashing light could trigger a seizure. Sometimes an EEG can be carried out while you're asleep, or you can be given a small portable EEG recording device to monitor your brain activity for 24 hours. So this is known as ambulatory EEG. You can also be asked to come into hospital for a few days to have a video telemetry and an EEG. So during this, an EEG and a video will be used to monitor you. So most people with epilepsy can be successfully treated with anti-seizure medications. However, they don't cure but can prevent. So there are many types, and this work by changing the levels of the chemicals in your brains that conduct electrical impulses. This reduces the chance of a seizure. So the type of ASM that is recommended is based on a number of factors such as the type of seizures you get, your age, whether there are concerns about interaction with other medicines, whether you're thinking of having a baby, and common stuff medications used include sodium valproate, carbamazepine, lamotrigine, levetiracetam, and these are available in different forms, including tablets, capsules, liquids, and syrups. So if you are on this, don't ever stop taking it because it can cause a seizure. If you are on other medicines, speak to your GP about it while you're on this, and this also includes over-the-counter medicines as well, because medicines can have a dangerous interaction with your anti-seizure medication and cause a seizure. So sodium valproate isn't usually prescribed for women who are able to get pregnant. This is because it can cause the baby to have physical defects or developmental problems. There are side effects, so they're usually short-lived and pass in a few days. And if your epilepsy is still poorly controlled after anti-seizure medications, you get analysed to see if you're suitable for surgery. So you'll get various types of brain scans to find out where the epilepsy is focused, memory and physiological tests, how it might affect you. So importantly, surgery is only recommended when a single area of the brain is causing seizures. That's known as focal seizures. Removing the part of the brain would not cause a significant loss of brain function. Most people recover from the effects of surgery after a few days, but it could be several months before you're feeling fit and return to work. So that's the end of today's video. I hope you had fun listening to this and look forward to seeing you in the next topic. Thank you. Bye bye.